Welcome once again to Registered Resident Occupant. And what I just got done was cleaning up my tablet camera lens portion with this electronic multi-surface pledge cleaner fluid. And what I did is I put some, as it was, some Kleenex, sprayed some of that on the Kleenex, and I rubbed the lens very gently with the Kleenex and cleaned that up. This cloth here, that's from wiping up the counter here. And what I do is I put that over here. This one here is ready to be changed out. And so that's changed out. Now what I'm going to do with this one is I'm going to come over here into my closet as it is and just put this on the shelf here. Actually, it's dry already. So I'm going to go ahead and put that in my cloth cleaning bag here. And I need mostly two hands to do that. So I'm going to put this down and get that in the cloth cleaning bag. Okay, back to the discussion that I was talking about before. And this is what we're talking about, is teeth cleaning in a daily personal care condition. Now we know that in the statement that ones make, that the present statement is to brush your teeth twice a day, and that can occur once in the morning and once before you go to bed. And I found a nice time to do that morning brushing is after eating. But before I do that brushing after eating, I have some other things that I do according to recommendations from the dentist. And what I have here, over here, I've got this water pick. What I do is I fill this up with warm water, and I turn it on when this particular attachment's in my mouth, and it sprays water in between my teeth, and in that way I get that food debris, the large portion of food debris, out of my mouth. It's a very nice rinse that occur to get that in between so-called interstitial tooth debris out of my mouth. And then what I do after that is then I go ahead and I brush my teeth. Now this is an old toothbrush, and this is a quality toothbrush that I have had for decade upon decade, and it saves me from purchasing another toothbrush. Now some dentists would say, well, you go to the dentist, you get a free toothbrush, you don't have to purchase one. But you have to treat your toothbrush properly so that it can last 6 months. Now you see the quality in the toothbrush here that occur, and as it is, you see that inelastic deformation of the bristles that occur. That's said to be too much pressure for what's said to be proper care according to the 2017 decree. And so what you want to do is have your toothbrush be such that there is no inelastic deformation to those bristles there. You can see how the breadth of this toothbrush is here with this condition. And if we get then the new toothbrush, and this is how the toothbrush is supposed to always look, and there is no inelastic deformation to the brushes there. And so it's a very gentle motion that you have on your teeth for as long as the toothbrush lasts, and it's said to be once every 6 months for most people anyway. Some dentists would say in special instances it could be once every 3 months, but no dentist that I've gone to has ever recommended going to the dentist more than once every 3 months. And in that condition, then what you have is this proper quality in toothbrush, the very gentle brushing that doesn't have the bristles resulting in a condition, inelastic deformation, being so-called bent bristles on the brush. So then after the rinsing is done, then I go ahead and I have the condition in, as it is, brushing my teeth. And then what I do after that is I go ahead and I get this non-alcoholic condition in what's said to be a mouthwash. And what that does is that puts antibacterial fluid in my mouth and deep into the crevices of my teeth and deep into the portions of my gum. And so that antibacterial quality is occurring in my mouth, and before I then do the last portion of the procedure, which happens to be the dental floss. When I get to the fine cleaning deep into my recesses of my teeth, and I'm toughening up those gum, then that's what the dental floss is doing, and it's very effective in doing so. But before that occurs, I go with this antibacterial mouthwash so that any minor abrasion and disruption that occur from the dental floss has that antiseptic already in my mouth and preventive medicine for anything that may occur from the dental floss. And so that's the 1, the 2, the 3, the 4 portion in the personal care, as it's stated this day by the general recommendation that these 4 things be used by one in their personal care between dentist visits. Now, brushing your teeth, that's twice a day. You can use this rinser to get those large food debris out of your mouth as many times you have a sitting eating. Now, this particular mouthwash here, it's really up to your own discernment. It doesn't say, for instance, twice a day on the back. And the floss here, that's your own discernment also. We know in that condition, the lesser time that you use this product, and also the toothbrush. In the morning, I use this in the morning. Well, anyway, that's beginning. I use the white toothpaste, and that's more of a paste. And then in the afternoon, I use what's said to be the gel toothpaste. So the particular condition and the image is gone. That states that my storage allocation is pretty much gone for this, but my audio still continues on. That's the process from the manufacturer's software that I have. And so in that condition, and continuing on, it's based on one's discernment. Now, we know that too much fluoride ingestion can actually be unhealthy, and the studies do continue about such things. But dentists say, well, the fluoride is as safe as it is according to the manufacturers in the mouthwash and the toothpaste, and that fluoride is there to help prevent cavities from occurring. And so I use that mouthwash mostly about twice a day, and I floss mostly no more than about twice a day. I brush my teeth, no more than twice a day. And I'm just getting back to the process in the mouth rinse, and I state that can be used this day according to the learning that I have, my own judgment, being a disciple of discernment, that I can use that mouth rinse in just warm water as many times as I have a sitting. It could be 6 times a day, it could be 10 times a day. Get those large food particles out of my mouth. Now, the other thing that mostly the Jewish people do in their discernment, if they had discerned it to be proper enough in their life, they would choose to chew gum, non-sugarless gum, from one sitting eating to another. The creatures, such as myself, are not encouraged to do that because the gum is from a tree, and we do our best effort not to be using conditions that are actually from a tree. Well, that's the discernment this day. A creatureless individual in personal care according to general recommendation by a dentist. That's this time in registered resident occupant.